Ayan na siya no. Hey, fire hit. Yes, they can't hear them now. Yes, they can't hear them now.
Hello, good afternoon, parents. It is very good to see us all here. I'm going to ask you, please, for 5 more minutes. I'll be asking you for 5 more minutes. Just to see if we can get some more parents in. There should be about 600 parents here now. And we just have gone 32. Hello, good afternoon, parents. It is very good to see us all here. I'm going to ask you, please, for
Look here, me care some come here. Hello, yo.
Yes, Simone, I saw your hand up. You have not selected the mic feature, Simone. I'm not even sure if you're hearing me now. Claudia, can you hear me? Claudia Burnett, can you hear me? Claudia Burnett, can you hear me? Good afternoon, parents, once more. Can I just have someone just letting me know that you're hearing me? Anybody? All right, thank you, Miss Wallace. It is really good to be in front of you today. And I hope with what we have to speak about today that you will leave here knowing that the government and the school itself does care about your children. And we're looking forward for a better year, one that we can say will be fruitful for all our students. Before we start, we're just going to have a prayer. We're just going to say the Our Father prayer together. Our Father, who art in heaven, hallowed be thy name, thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread. Forgive us of our trespasses, as we forgive those who trespass against us. And leave us not in temptation, but deliver us from evil. For thine is the kingdom, the power, and the glory, forever and ever. Hallelujah. Parents, we hope that as far as we are concerned, if you're here, it means that you have gotten the message. And if you have your radios tuned and your TV tuned, yesterday you would have heard the Minister of Health, Minister of Education, and the Prime Minister speaking about going forward. Now, what you got today was a questionnaire and an outline of where you could go to have your children vaccinated. This is not saying that you must get them vaccinated, but as you have read in the letter, priority will be given to those students who are vaccinated. And as far as I'm concerned, I think that the only persons who will be allowed to be at school face-to-face will be those students who are vaccinated. Now, there are so many things that you might have been hearing. There are so many things that you might fear. But let me just remind us that we all took vaccines in the olden days, and there's nothing really wrong with us than we did not get the disease that we got vaccinated for. This vaccine is the same thing. And based on what you have heard, that it is made from child's placenta, it is the mark of the B666. I need for us to put aside all that you have heard because what you're hearing is not true. We need to make a decision because you would have seen where your child would have been for the past year and a half from March 2020 until now, when we just did exam recently. You would have borne all the problems with internet, with getting work done, with getting work to the child. You'd have seen it. But there's a decision that we need to make. And that decision is what is going to pave the future for our children. Now, as I said clearly before, nobody is saying that you must. However, you have to make plans if you don't. Plans such as making sure that they have a device, plans such as making sure that they have internet access, because we will have to do what we have to do from this end to reach your child. We know for a fact that it is hard for your children to learn online. And so we are given this opportunity to have our children vaccinated and protected. You would have heard too, if you're listening carefully, that this new Delta strain is deadly on the children. Now, before, the strain was not bothering children, and they would have gone through many different strains. But this one that is called the Delta, that Honorable Christopher Tufton would have mentioned recently, is now in our island. We have to find ways of making sure that our children are protected. We had a recent exercise with our grade 11s here, and I can tell you that most of them that comes out of a taxi does not have on their mask. The simple thing is wearing a mask. When they're on our campus, they have the mask on because our teachers are on them. But they're open and so open to the outside. And with that, we need to make sure that at least we give our child a chance to protect themselves. I have been vaccinated. Some of my teachers have been vaccinated. Some of my admin staff have been vaccinated. And yes, some of us had some what do I call it now? Symptoms. I didn't. And I took, I didn't have any such. But there are a few who had to stay home for a day or two. This is what a vaccine does. If you remember when you get that one that marks your right arm or your left arm, that big cut one that is on your arm, you know which one I'm talking about? Shake it if you know what I'm talking about. You know that one, right? So you remember that some of us had fever. Some of us had a little sickness. Some of us, it took a long time for that one to get better. And that's what a virus does. And that's what a vaccine does. So I need for you to understand that the vaccine that they have developed is just to help the body to be able to fight against whatever might come. Is it going to prevent you from getting the virus? Hold for me, please. Hello? Yes, she did. August 31st. Very sorry. Right. A vaccine is designed that when it goes into the body is able to fight against it. So that when it comes again, then the body knows how to deal with it. So let me explain that a little bit better. A virus is something that takes over the body and causes it to change. When you get the vaccine is a small amount of that virus that the body will be able to manage, and it keeps a memory how to deal with it. So you would have known about chickenpox, that if you get chickenpox, people tell you that you don't get it again. It's not really true. You do get it, but the body knows how to deal with it, so you don't show the bumps up the second time. So it's not that you really don't get it. You will get it, but your body won't show the bump like what it showed the first time, because your body now remembers how to deal with it. And this is how this vaccine works, or any vaccine whatsoever. Once it goes into the body, some things called white blood cell fight it out, know how to defeat it, and anytime that comes again, it will remember how to defeat that virus, and you're good. So let me encourage your parents that, as far as I'm concerned, although I still need to wear masks on the campus when my students come back, it is for our own good. Let me encourage you to have you yourself to get vaccinated if you have not done so as yet. We ask that you get your children vaccinated too. Not even just to come back for face-to-face, but to make sure that at least they are protected in a manner that their body can deal with what is to come. It's not over yet. We don't know when it will be over. And so we have to do our best in keeping our children together. So you'd have gotten a letter from the school. You'd also have gotten, for those persons who are in grade 9 now, we're going to grade 10. Those in grade 10 going to grade 11, 12 going to 11 going to 12, and 12 going to 13. You'd have gotten a Google form for you to fill out if and only if you have decided to have your child take the vaccine. You don't have to fill out the form if you're not going to have your child take the vaccine, but if you're going to, this is in the planning stage. It starts tomorrow. It goes up until next week, Tuesday. the nurses and the doctors need to plan for the day. And so they are in need of this information. So if you have decided in your heart, in your mind, that say, hey, I want to take this vaccine, that is what the form is for. If you're not going to have your child do the vaccine or yourself, then you don't fill out that form. You only fill it out if your child will be taking the vaccine. So there are two of them. There's one for 7 and 8. That one, it is not really, this vaccine blitz is not for really low school. But if a parent want their child to get it, if you turn up at the different centers, you'll not be turned down. You will have your child getting it. But for the lower school, it is for those persons who have certain issues, like for asthma, who have diabetes, who have certain issues. We are the most urgent person to get the vaccine. And that is why I went and got mine, because I have some ailments. And I know that when you get the virus, if you have ailments, your chance of getting it rough is great. So I went and I got mine. So for grade 7, going to grade 8, and for grade 8, going to grade 9, those students, there's a different form that you'll get. I think your teacher would have put in a group. If you want to take the vaccine, you will fill out that form and the Ministry of Health will get it and will expect you to come to the different sites for you to get your jab. It's a scary moment, and I don't want you to be scared. There's so much information out there, but you have to follow what you know, and you know for a fact that back then you got the same type of vaccines with different things in it. Mercury was one thing in it that is a poison to the body, but we got it. The filling that you might have in your teeth, if it's silver filling, it is mercury, not supposed to be inside of you, but we did. And so we're asking you, please, for the sake of your household, for the sake of your child, we are encouraging you to take the jab. Please. Is there any question, any comment, any venting, anything you want to say? Anybody here? Yes, Mr. Wallace.
Hi, it's actually Miss Wint.
Sorry. You're sorry.
I just wanted to know, when will these letters be sent out?
The letters were sent out today. It should have been in the WhatsApp group. If you had this meeting link, the message would have been sent before.
No, I only got this meeting link. I didn't see anything else.
Whoa. All right. Which group did you get it in?
Grade 7P parents.
7P parents. All right then. Great. So that's what is marked there?
Yes, that's the group.
Okay. Hold on. Grade 7P
parents.
Hold for me. Don't move. I'm going to be sending it right away. But it was also sent just a while ago to your child's email.
Oh, all right. I'll look there.
I'm still going to resend it in the group, so just give me a minute.
Okay.
This is grade 7, you said, right?
Yes.
Okay. 7. All right, it's in the group now. It's
All
in the
right.
group.
Okay, thank you.
You're welcome. Miss Morris,
Yes, good afternoon, everyone.
good afternoon.
Question, if the child does not get the vaccine, will they be allowed to face-to-face classes?
All right, now based on what the minister said, no, they would not be able to go
Allowed.
face to face, right?
Okay.
So you're going to have a situation where there are different medias out there. There are different medias out there, but it's not fit to Spot Valley. Spot Valley have their teacher fit to our students.
Okay.
If those medias are out there, then you can stay home and deal with those. But at the end of the day, they still have to do the exam from here. You don't know where your child will be.
Exactly.
Right.
All right, no problem.
So as I was saying before, Mommy, I know that we are scared. I know that we're hearing all sorts of things out there. But when I tell you that I had no reaction to it, to the 2 jobs, trust me on that. There are some persons who do have it, not going to lie. Very few persons on my campus here, the teachers or the admin staff, very few had side effects, but those
Okay.
were with diabetes or high blood pressure. So it was not good for them. I have diabetes, I have high blood pressure, but it never do me anything.
Okay, principal, no worries.
All right. Nice.
Thank you.
You're welcome. Julianne Mullings.
Good afternoon, sir.
Good afternoon.
I trust that you're all well. My name is Julian Mullins. I'm the Parish Health Promotion and Education Officer with the Ministry of Health. I
Nice to
got
have you here,
link.
Mullings.
Yeah, I got your link not long ago. Just a
Mr.
few
Beetle?
minutes. Right, Mrs. Beetle sent it to me. I don't know if she got on the platform, but I'm just now getting on. I apologize for the late access. But Mrs. Beetle is on the platform. Did she address you?
No, she didn't.
All right. So if I may, at this time, I just wanted to, the platform has on teachers and parents, does it?
Most of it are parents, because we'd have gone through extensive meeting with our teachers.
Okay, okay.
They're very much aware of what is to be done.
All right. So just to give a little highlight on what it is that Ministry of Health will be doing, especially for this weekend, we will be having what we call a COVID vaccine blitz at the Mount Alvernia at a number of sites, and this is to facilitate the vaccination of students from age 12 who has comorbidities, meaning that they have some underlying conditions, whether diabetes or asthma or any one of those. All right. So persons with for students 12 and over with comorbidities, and they're going to be focusing also on the ages from grade 10 upwards. All right. Now we are going to be administering these vaccines, and the service will be offered from 3 locations for the weekend. We are going to be at the Mount Alvernia High School. We're going to be at type 5 here, and as well as Kent Avenue. That's where Sandals Inn is. We are going to be operating from those sites from about 9 to 4 p.m. All right. So we are asking that parents will take their children out for the vaccine. They may need to take an ID. They will need to take an ID, some form of identification. So like a school ID is good. If they don't have a school ID, then they can take a birth certificate or a letter from a JP to say that they're who they are. If parents are there, so the child must be accompanied by a parent or a guardian. Will not take children alone. All right, it must be accompanied by a parent or a guardian. And if that guardian or parent has not gotten themselves vaccinated and would like to, then we are able to facilitate them at the same time. All right. The aim of all this is really to curb the whole increase in the spread of COVID-19. It has really gotten out of hand, and we are trying to see as much as possible to see if we can vaccinate our population so that we can experience that herd immunity that we are trying to accomplish. So I really hope that persons will, join us in the drive and help us to get our country back. I want to emphasize at this point, though, that taking the vaccine does not prevent you from getting COVID-19. All right. So a lot of persons have an issue with that, and they'll ask, so why am I taking the vaccine then? And my answer to them is that as much as the vaccine does not prevent you from getting COVID-19, what it does, it reduces the impact. So it reduces the hospitalization, and it reduces death. As you know, our hospitals are overrun at this point with COVID-19 patients, and the death rate is going up. So once you're vaccinated, the impact of COVID-19 virus itself becomes less effective, and so you're able to pull through. All right. COVID has been around for a while, and by all indication, it may be around for a long time to come. So we just need to do what we have to do to protect ourselves in the best way, which means that we have to maintain the protocol. So even after being vaccinated, we have to maintain the protocol. We have to ensure that we still wear a mask, still sanitize, and still stay our physical distance from persons. So with the lockdowns that we're having now, I know it's not the easiest thing to deal with, but we're asking persons to please ensure that you follow the protocols and use the means to do other stuff that we didn't get to do in former times. We know that also mental illness seems to be on the rise as a result of these restrictions, and in terms of persons not accustomed to this type of lockdown and isolation type of thing. And so you find that a lot of persons are registering mental instability. So we want to tell you that we have the support at the Type 5. We have our mental health team here who they are ready and willing to give the support in whatever way. So don't feel cute or feel afraid or ashamed to reach out. All right. And if you see your family members behaving unusual, just know that there's help there to reach them for them to get back their selves. All right. So I just want to put that out there. I don't know if anybody has any questions that I may be able to.
I'm just going to add. That I was explaining to them that the vaccine is like the chicken pox. You get chicken pox, you get over it after 14 days, but it's not that you don't get it back. You will get the chicken pox, but your body know how to deal with it. That was one example that I used before you came. Hello? Nurse, you got that just a while ago? She's gone. All right. So on the screen, I'm coming to you, the parent of Ricardo Wallace. On the screen, because I know that you might be outside of St. James. So we have locations in St. James, Westmoreland, and Hanover and Trelawney. Again, this was all sent to all parents. So for tomorrow, if you're in St. James, yes, Mount Alvernia, Type 5 and Sandals Inn. If you're in Westmoreland, Manning's High. If you're in Hanover, Hopewell High. If you're in Trelawney, Clarkstown and Falmouth. So you can take note of that, and those areas will be open for both Saturday and Sunday. So as you can see here, the different places that will be open over the shutdown period, you will be allowed to go and do your job, you and your child, if you so desire. And these are the different places that you'll see with an X in it in the letter that was sent to you. Ricardo Wallace.
Hi, I missed a portion of when the nurse was speaking because the power went out. So when going with him, it says I take an ID, or he doesn't have a school ID.
All right, so you can bring your birth certificate with you, or
His
a letter
birth
from the
certificate,
baby.
or
His birth certificate.
uh-huh.
Because it will have your name on it, and you should have an ID.
All right, so that will be good. My ID and his birth certificate.
Yes,
All right, thank you.
you're welcome. Just looking in the chat. I'm not able to unmute either. The host has. Miss Mullings, you need to say something? Miss Mullings. Give me a minute. It's fine. Julian Mullins, you can now unmute.
Thank you so much. I was muted for a while there. Yes, I was trying to respond respond to what you're saying with regards to the chickenpox situation. Yes, so once it is that you are immunized, you're vaccinated against this virus, then it equips your body to fight. So the next time that you're exposed to it, then the body would actually recognize that antibodies will be made up, and then your system is able to recognize that, oh, this looks familiar. I know how to deal with this. All right. So it is really, the vaccine is really just to equip you, get your body at that level. It does not negate you eating right and exercising and getting your rest, though, but it is just an addition. Thank you.
All right, I see something from Eric Laws that it is ridiculous. No one should force you to your kids in order for them to get education. Now, whether you're vaccinated or not, Eric Laws, you will not be prevented from being educated. The thing is, we just have to prepare ourselves to do our classes from home, because being here, the person who is vaccinated who might have it, give it to your child. So we need to make sure that your child is protected. So we're not forcing you to. There's options that we will have in order to educate your child just the same, even though they're not face-to-face. Why am I going to take something that is not supposed to be in me, which is much less my child? As was said before, I don't know who this is, Ms. Shante Chin, you would have taken vaccines before that is not supposed to be inside of you. But when you were smaller, you just go to school and hear that you have to line up to take vaccine shot, or since of lately, from your bond, you go to the center every now and then. You carry your child for vaccines and you're getting things that are not supposed to be inside of you. But we took it because we know for a fact that if you don't take the polio, you get the polio. The child is going to walk on 1 foot higher than the other. If we don't get the MMR, there are so many things that will happen, but we did take our child to get it. So I do understand what you're saying. We have to look at the other side of the coin, and nobody is forcing you. Nobody is mandating that you should. We're doing what we have and hope that you will take what we're saying and make a safe choice. Is there anybody else who would like to say something? Okay, hold on. Miss Diana Phillips. Diana Phillips. Go ahead and unmute, Diana.
Can I say now?
Yes, you can speak now, Miss Phillips.
All right. I was just asking if the Adelphi clinic will be open tomorrow for the vaccine.
No, the clinics that will be open tomorrow. Adelphi will be open on Monday. The clinics for tomorrow is
But on Monday is a lockdown day.
No, you will be allowed to go to do the shot. It's not going to prevent anybody. Remember, the lockdown is from when, Sunday or Saturday?
Yes.
Right.
Sunday, Monday, and Tuesday.
Right. So the Prime Minister had said that we can go to do vaccine.
Okay, then. All right, then. Thank you, sir.
Deborah, you can now unmute.
Hello, good afternoon,
Yeah.
sir.
Good afternoon, Deborah.
I was saying that one of my classmates, and they were like saying that they're sure that the vaccine, saying to them that if the vaccine and sister is vaccinated, I'm going to take
All right, Deborah. I'm not hearing you too well. You're chipping in and out. I'm not hearing you too well. So if you can hear me, you're chipping in and out. So we're not getting a good idea of what you're saying. So let's go again. Deborah? All right, we're waiting on Deborah. So in the meantime, I'm going to unmute Carlisa Smith. Carlisa Smith, you're unmuted.
Yes, good afternoon, sir.
Good afternoon, Smith.
I was thinking because my mother, she's not letting us take the vaccine at all. But I'm saying if we do not take the vaccine and we cannot come to school face to face, is there going to be online classes for us who's not taking the vaccine at home, who's staying at home?
Yes, there is going to be online classes. We have to find some way of doing classes. If it means that we have to buy a little camera and to boost up the internet, we have to find some way to make sure that the classes just the same. And I will encourage you to listen to your parents, listen to what the Bible says, Ephesians 6, that you should obey your parents because this is right. All right?
Yes, sir. I follow. I do. It's not just because mommy say I'm not supposed to. If God don't tell me to take it, man cannot take me. Tell me to take it, so I'm not going to take it.
All right, dear.
Thank you.
Dante Howell. Dante Howell, you can unmute yourself.
Good afternoon, sir. This is Stacey and Rose, Dante Howell's mommy.
Yes, yes.
How are you?
I am fat as usual.
Afternoon, everybody. Well, it's the same question for the based on what the young lady just said. I wanted to ask because I'm not comfortable right now to give my son that vaccine. So I just want to know that everything is still good. Coming the 10th of September for classes to start online at 8 a.m.
Yes.
Okay.
So
that's my question for now. Yes.
All right. Thank you. Thank
you.
Very
Sir. All right, sir.
Q5 plus. You can unmute yourself. Q5 plus.
Good afternoon, sir.
Good afternoon.
I just want to know if 10th grade is going to go to school September morning, face to face.
10th grade will be at school once you have been vaccinated. If you have not been vaccinated, then you will be on the online platform.
Not hearing you, sorry, I kind of broken up.
All right, so grade 10, yes, will be at school, those who have been vaccinated. If you have not been vaccinated, then you will have to do your classes online. You heard that now?
Okay, sir.
King? Tanashe King?
Good afternoon, sir.
Good afternoon.
I was wondering, if we do take the vaccine, are we going to have face-to-face classes?
Which grade are you in?
I'm in 8P going to 9th grade.
All right, so right now, based on what the minister is saying, I think that we're focusing on the grade 10, 11, 12, and 13. However, if you have issues, some sickness like asthma, or diabetes, or some other sickness, then you will be asked to take the vaccine. But I don't think right now, based on what I'm hearing, that grade 8 will be in school. So we have to keep a listening ear to what the minister is saying between now and the end of the lockdown. So make sure that you listen to the news every morning at 6 o'clock, listen to the other one at 7 o'clock, just to hear what the country is saying as it relates to coming back to school. You'll be hearing from us too, but that is where sometimes you get the news quickly.
Okay, sir. I was wondering if we're going to have orientation online or face-to-face.
If you got your report, you'd have gotten a letter that mentioned the dates for orientation. So yes, we'll be having our orientations online.
Okay, sir. Thank you.
You're welcome. Ms. King. Ms. Barrett. Shalanda Barrett.
Okay, thank you. This is not really related to the vaccine. I'm wondering, like how we parents paid our school fees last year and our children haven't seen the classroom. Do we still have to pay the school fee for this year?
What grade is your child in?
He's in 7-0.
7-0. So we have a lot of things that we owe you. We have rule book, we have your gear, we have your pin, we have, I don't know if you got your crest.
Yes, I got my crest.
Right. So the only thing that I think that is he on path?
Yes, he's on path.
All right. So basically you don't have anything to pay apart from, I'm not too sure, I can't tell you offhand now, but I don't think that you have anything to pay. If you have something to pay, I can't tell you off the back of my head right now.
Okay.
All right.
Okay.
I'm not saying that there's nothing to pay right now. I know for a fact that you are not going to pay what some students are paying now, because the insurance will be paid, and I think ID or something like that, which is what you would have paid if you were not on par.
I paid for all of those already.
That's what I'm saying. So going forward, if you were not on par, there would have been something for you to pay, definitely, but I can't tell you offhand right now.
Oh, okay, okay.
All right.
Yes.
Shalanda. All right. Can you just text me your number, please, so that I can get back to you? Miss K, or K, I should say. I don't know if it's a miss or not. Okay, you're cracking in and out.
I'm teaching a meeting with them. So how much persons in your meeting?
Miss K, I'm not hearing you, so I'm going to ask Miss Wheatle. Oh, Miss Wheatle is here. I'm just going to ask Miss Wheatle to speak to us. You can unmute, Miss Wheatle.
Okay, good. A pleasant afternoon to you all. I'm Marceline Wheatle from the Western Regional Health Authority. I'm very happy to be on this platform sharing, sir. Just to verify, do we have parents, children, and teachers? Who do we have? You need to unmute, sir. Just verifying the group that is in the audience.
We have parents from grade 7 to grade 13 in the group. The parents from grade 7 to grade 8 understand that they will be at the site for comorbidities, and grade 9 to 11, 9 going to 10 will be there for the vaccine.
Right. I guess you had Mrs. Mullings on, Mrs. Grandis Mullings, Parish Health Promotion Education Officer.
Yeah,
So she would have given a, right. So she would have given you a brief update as to what is entailed for the Blitz starting tomorrow for our children. We are really encouraging this group that is now represented on this platform to really consider taking the Pfizer COVID-19 vaccine. It is one that will help us to get back to school, to get back to normality. It has been proven, it has been tested that the vaccine is safe, that the side effects are no different from other vaccines we have taken, that it is one that would have been tested and tried. The concerns regarding fertility, to say if I take the Pfizer or any of the COVID-19 vaccines, I'll not be able to have a child. That is a myth. The fact is that persons who were enrolled in the vaccination trials got pregnant. They concerned about if I take the vaccine, I am unable to breastfeed. No. People who have taken the vaccine continue to breastfeed. I know that there is the fear, the hesitancy about the vaccine because of the misinformation being spread on the social media. But I have taken the vaccine in March and I'm still healthy. I've lost my dad because of COVID-19. He lived in the States and we could not have a proper funeral because he died at the height of this pandemic. So I'm encouraging parents to come on out with their child or their children to Mount Alvernia High or to the Montego Bay Type 5 Health Center or to Sandals Inn to get their vaccination. I really applaud this effort, Mr. Principal, for you bringing on the platform your parents. I know you do not have everyone, but I guess word will spread easily. What I'll do in your WhatsApp chat, I'll upload some specific information, some flyer that speaks specifically to what we are doing over Saturday, Sunday, Monday, and Tuesday for the first phase of the vaccination program. So thank you for having us on the platform. I will, if there are any questions, we will entertain and then bid you goodbye.
Well, I think most of all, the concern is really that the information that is out there that the vaccine is made from placenta. Why should I put something that is not supposed to be in the body inside there? So basically, there are some parents who fear the vaccine, and
right.
I am doing my best to soften the soften the, what you call it, the
their
feeling.
anxiety or to reassure them.
Yes, yes, yes.
We are together working on this and we want to reassure each and every one. As said, the vaccines have been made from the expertise of scientists who would have developed all the other vaccines, the vaccine for TB, polio, measles, chicken pox. These are the same scientists that would have developed the vaccine. There are fears and they're genuine and I can understand, but also I would want to point persons to read the negative, to read less of the negative and read valid information as set out by the World Health Organization or the CDC, that is the American Center for Disease Control. Read those, read that information, speak with your health worker. Over the years, Jamaica would have had a safe record of carrying out vaccination programs because of our training. So at this point, we know that there are concerns. We know that there are negatives, but my understanding from all that I've read is that the vaccine is made from credible ingredients that we use from a day to day, that the vaccine technology would have been advanced over the years, having made other vaccines. And so we want to encourage each and every one of you to read a little more of the positive information and to consider what it is doing to our hospitals, in our hospitals right now. Consider the loss of a breadwinner. So many fathers, brothers, sisters, mothers would have died as a result of the COVID-19 pandemic. Listen to the news. Those are the persons who would not have taken the vaccine or would not have gotten their 2 doses of the vaccine if it's the one that they're required to get 2 doses. So the stat is showing that the people who are dying are the ones who have not taken the vaccine, and this is happening worldwide. So we could talk again, we could have more of a longer presentation, but at this time, I will pause here. I will provide you, sir, with some additional soft copy of materials that you can circulate to your students, your staff, and their parents. All right, thanks much. Over to you, sir.
Thank you very much, Ms. Whittle. Thank you so very much. So we have heard from 2 medical personnel, and I'm going to ask Ms. Phillips to, if there's any question for the nurse, for the, it's sister, right?
Yes, I see. Okay, sorry, go ahead. Sorry.
Good afternoon.
Yes.
I'm a COVID-19. I got COVID-19 like 3 weeks ago. I'm wondering if I can take the vaccine tomorrow or Monday.
My take on this is that consult with the health department. You could, based on your status at this point in time, based on your clearance. However, though, I've seen persons getting the vaccine under 3 months of having been exposed to the COVID-19, right? But what I recommend is your status. Once it is okay with your doctor at this point, given that it is only 3 weeks since you have had it, based on your level of your health status, your doctor is the best person to tell you at this point in time how soon to take the COVID-19 vaccine. For others who would have had COVID over the past, say, 2 to 3 months, it is okay for you to go to the vaccination site and take the vaccine. In the meantime, I would encourage those who may have a medical condition that cannot take the vaccine to continue to adhere to the prevention guidelines. That is the wearing of your mask, especially if you have to travel in public transport. To our students who are going back to school as they prepare, whether or not you take your vaccine, I am saying to you, as you enter a vehicle, please wear your mask. Communicate less, because it is said that persons who travel in a public vehicle are 3 times more likely to contract the COVID-19 than if you were in the open air. Once you get close into a Noah bus or into a taxi, 3 of you in one space, if any of you have the COVID-19 and you're not properly covered in your mask, then you're likely to contract COVID-19. I hope I've said it and you understand
Okay then, miss. Thank you.
You're most welcome. Yes. In your chat, sir, if I may quickly look, we are only hearing about the positive things that what persons or what about persons who took the vaccine and was negatively impacted and or who were negatively impacted. We are not hearing. Yes, you hear. It is said that 1 out of 10 persons will have some form of severe reaction. 1 out of 10 persons may be allergic to an ingredient in the vaccine, just like how we may take or medication for hypertension, for diabetes, or any other vaccine. 1 out of 10, it is likely that you can have a severe reaction, or 1 out of so many other persons may come down with some condition. So let me point you to 2 things that could have impacted the vaccination campaign negatively. One was where some persons would have taken the vaccine, would have gotten a blood clot. It is said that many of us are predisposed to clotting or deep vein thrombosis. However, though, something may trigger it. Some medication would have triggered it, or some situation in our lives would have triggered it. So it is a given that blood clotting, it is possible that over time persons can be exposed where they take a particular medication. We do not know. It could be aspirin or it could be something else that also triggers your condition. So we'd have heard about the AstraZeneca vaccine and Johnson & Johnson, yes, causing blood clotting. Again, it's within a specific age group or if you have a particular risk factor. Say, for example, if you are overweight or obese, if you smoke, if you're on contraceptive, these are some of the studies that would have been done amongst persons who reacted negatively to the vaccine. And they're saying that the percentage is rather low. The greater portion or proportion of persons who took the vaccine, they have reported less adverse reaction or complication. More people benefit from taking the vaccine and less persons develop some reaction. These reactions maybe sometimes I'll give you the example, many of us are allergic to fish. Many of us are allergic to nuts. So this is how it happens when you have a pandemic and when you have more people having to receive this vaccination, then you're going to find some of those persons who will react to the vaccine. It is possible. It is possible, but then it is a smaller percentage. All right, and there's another question that states that, I think it's a WHO, let me see, my child is going into grade 10 or 10th grade. So I'm not sure of the coordinator. Okay, that's a school problem. That's not a, all right, I think Bella, the other questions are relating to you, sir. They are your administrative issues. And so I think I would have addressed, oh, there's one. If I read correctly, the WHO said that the vaccine is not mandatory, but yet still we are being forced to take it. I don't think we have the system as yet where we definitely outright forcing persons to take it. The other vaccines are mandatory. Over time, COVID-19 will be mandatory given how it progressed in our population. And if if it becomes one of our long-term immunizable conditions. So if COVID-19 become a part of the classification of diseases that needs vaccination, over time it will become mandatory. For now, it is not, but there are some conditions. There are some conditions because it is a pandemic, and under the Public Health Act, if there's an outbreak or if there's a pandemic of this magnitude that is every day an average of say 9 persons or so you hear passing away, then it will call for the reinforcement of some public health regulations. Children who are vaccinated will be allowed to travel on public transport and come to school. But children who are not vaccinated, because of the risk of them developing COVID-19, then they will have to do the online sessions. So it's not that outrightly we're saying tomorrow, if you opt not to go to Mount Alverna, then the law is going to penalize you. No, not yet. For now, let us not spread the negatives and let us stick to it. We are encouraging, we are coaching, we are begging, we are pleading to say, consider taking the vaccine because we are in a public health crisis. If it was Ebola, God forbid it, when we were bracing for Ebola, they raced towards designing a vaccine quickly, and nobody had an issue because with Ebola, you didn't have masks to wear or social distancing. Ebola, it is so highly infectious. And so persons would have maybe raced towards a vaccine if it had reached pandemic proportion. Now we're saying COVID-19 is a pandemic. Everywhere on this earth is impacted, but more so, it is driving into poverty. If it is driving us into illiteracy, it is taking away our social life. And so we want people to wake up and look at the reality of the situation. The vaccine, I'm going to end, of all the scientists we are listening to and all the experts, they are pointing us to the fact that the vaccines are safe. They have been used and the technology used are similar, would have been similar to the ones used for the other vaccines. So I crave that you will demonstrate your civic duty as well as you will try as much as possible to educate yourself about the vaccines. Thanks much, sir. Thank you for having us, and I'm going to leave now so that you can get back to business. Thank you.
Thank you so very much, Ms. Wheatle. I really love what you're saying. I think from the pandemic start, this is the best that I've heard. Thank you so very much, Ms. Wheatle. So we have 2 more hands up. Let me see first, Ms. Mullings, Julianne Mullings, or the parent of Julianne Mullings. You can unmute.
Oh, okay, so, right. It's not. I'm not a student, sir. I am Julianne Mullins, the health promotion officer, counterpart to Mrs. Wheatle. I just want to, applaud Mrs. Wheatle for the information that she has given.
Yes.
And I just want to end myself with just a couple of pointers. One, you're encouraging persons to do your research. There is a lot of information circling out there, and just as though we have a pandemic, we can have infodemic also, right? That's an overload of information, of negative information in particular. And because of how advanced we have become at technology and so on, the information keep pouring in. But we have a responsibility to choose what we believe. Choose reliable sources, such as the World Health Organization or even the Ministry of Health or the CDC. You try to get information from these sources. These are reliable sources. These are research-based sources. Don't just take everything that everybody says. because one person's response and reaction to the vaccine may be a total different one for another person. I give you an example. During the vaccination, one of the vaccination session here, I remember a gentleman came and he was petrified. He said, I don't want to take the vaccine again because the last time I took the vaccine, I lost my erection for 1 whole week, right? And he went on and went on. Then, but there was another person who came on and the person was able to say it was the opposite for him. So you find that you have different persons having different experiences, and you just have to have your own experience. So get your research and get it from reliable source. Another response I'd like to give is there's a message in the chat that says that the vaccine doesn't stop us from dying or from getting ill. And I am saying that there was nowhere in any communication that guaranteed that you wouldn't die. Remember that COVID is not the only reason that people die, all right, or get ill. What we are saying to you is that in particular to COVID-19 virus, the vaccine will help to reduce the impact of the virus on your system. So you find that hospitalization will be reduced as well as death. So I don't want persons to go and think that, oh, once I take the vaccine, I am good to go. I can go without my mask and I will not get COVID. What we have been saying in essence is that taking the vaccine does not prevent you from getting the virus and passing on the virus. But what it does, it reduces the impact of the virus should you get it. And therefore, it reduces serious illnesses as well as death. And the final point that I want to make is that I find it very alarming or very, very funny that coming across a lot of persons, and it happened with the COVID-19 sampling also. So we'll come across persons and they say, you know what, I'm not taking the COVID-19 test because you know what, it is on the swab. The virus is on the swab. And so once I stuck it in my nostrils or in my throat, then they're giving me the virus. And people have heard persons say that over and over. And I see the same response where the vaccine is concerned. The person saying that I'm not taking the vaccine, I'm not taking the vaccine. But then they get a call from foreign. And the foreign call that they get is that, oh, I have a ticket for you. I have a little job over here for you. And I want you to come up and work. And immediately you see they find themselves at the health department and they said, you know, I need to travel. So how do I get the vaccine and how do I get tested? My point is that sometimes persons don't want to do what is best for home, but they will do it if it means that it is a ticket to go away. All right, so let us do the right thing in getting our country back on track. You know, it's not a job for one person, it is all of us. And so I encourage persons, you do research, get the relevant information and take a decision. And even after that, ensure that you follow the protocol. Thank you so much.
Thank you so very much, Ms. Mullins. Thank you, thank you. I see one more hand. There's Bijan Brown's parent, I guess. You can unmute. Bijan's parent. All right, we're not getting Bijan, so I'm going to allow my nurse to allow our school nurse to speak. So I have unmuted you, Auntie Joan.
Can you hear me?
Yes, I can.
Are you here? Good afternoon, parents and students and other colleagues, Mr. Thompson. I am in and out because my service seems to be very poor, but I will get another opportunity to speak with the parents and the students. I just want to say that I have taken the vaccine like Mr. Thompson has, and it is safe enough for you to take. If you have lots of queries and you need lots more information and you need explanation, Mr. Thompson can give you my telephone number. And so you can reach out to me, parents and students. I'm not so sure you're still hearing what I'm saying, but I just want to say that bit for now.
We're hearing you. We're hearing you good, nurse. So that was our school nurse. I will pass on the information for nurse into the groups and they will contact you. So we're not getting on to Bijan as yet, so we'll go to Samoya Knight.
Hello?
Yes, we're hearing you.
Okay, my concern is I'm a parent who is fully vaccinated because I'm in Canada. And first and second vaccination, I have a lot of side effects. So my main concern for my child is the side effects.
Okay, so as a nurse said, and I was saying the same thing, we can't know how it will affect anybody. I can only tell you that the vaccine is funny and the body is also funny. So I have a mother-in-law who have high blood pressure, diabetes till one of her foot was gone, heart problems, not seen. She got the virus in that state and she just lie down in bed and she vomit, but she didn't die. And there are some persons who would have died. So we can't tell you exactly what the reaction will be. There was no reaction with me. My first one, I went on my farm and I worked for about 6 hours and went home, bathe, go to bed, get up back. My second one, nothing. But there are some persons who do have side effects, especially with the second dose. Never kill them because that is how vaccine works. No matter which one, if it's MMR or it is one for polio, it will cause side effect. You will have flu symptoms, you will have fever. And if you could remember back then when you're little, or you remember when you have the baby and when they get the shot, the doctor usually tell you, give them cetamol or whatever if you see any symptoms. This is what happens with the virus because the body is now training itself to deal with that type of virus. So we can't really tell you what will be the outcome. All right, so I'm now going to go to Miss Burnett, Claudia Burnett. You have to unmute yourself, Claudia. I send you a mic, right? Good.
Okay, this is Miss Burnett. And I'm working in the hotel industry, and my daughter goes to Spot Valley. That's Jada K. Green, and she will be going to grade 11th September. And I am one of those persons that take the vaccine and I don't have any complication. But what I'm saying, she will be going to grade 11, and I want her to take the vaccination, but I want to know if I had to come to the school to get the form or anything like that.
You mean form for the vaccination?
Yes.
The meeting link that you got, there should have been another form that you fill out. It was sent with this meeting link. You didn't get that meeting link? You didn't get that form?
No, I did not.
Which group you got it in?
I did not get that form. I only get the medical form.
No. Let's go again. You got this meeting link from somewhere.
From in the group.
Right. In the same group, there's a form that you need to fill out. There are 2 things that was sent to you. The meeting link. No, 3 things. The meeting link, a letter from me, and the form.
Okay. I have another parent here where our daughter is still in which grade? Grade 9. Grade 9 that student will be going to. Show me.
Hi, morning.
My dear hardworking people. It's the same
How
thing.
you doing?
You have to check your phone. If it is not there, it is in your child's email that they use for classes. So that MOE email that the ministry gave to them, they can check their email and all of this. The form, the dates, the letter from me is in their email.
Okay.
Right?
Okay, sir. So I'm going to check my phone. Everything in the email.
Yes. Which hotel is this?
Wow. I didn't hear.
Which hotel is this?
Gerald's Grand Hotel on the Rosal Street.
All right. Me no want them fire you, you know.
No, no.
Cool.
We already told our supervisor that we are going to end the meeting.
All right. So you finished with your thing now?
Yes.
All right, cool. Adlam, Shanil Adlam, you can now unmute yourself.
Good evening, sir. I wanted to ask you, when are we going to collect the book list?
All right. Are you talking to a student?
I'll be going in grade 10.
Are you talking to a student?
Yes, sir.
All right. Did you get your report?
Yes, sir.
In the same time that you got your report, the book list and everything would have been sent. Please check your email again.
Okay, sir.
All right. Welsh, you can unmute.
Hi, good afternoon to everyone. What I really want to know though, is it mandatory for the children?
All right. Are you asking if it is mandatory for your child to take the vaccine? Just say yes, because I can hardly hear you.
I want to know if it's mandatory for the children to take the vaccine before coming to school.
One thing I can tell you based on what the minister said, your child would not be face-to-face at school without the vaccine. So if they don't get the vaccine, they will have to do their schooling from home. All right, Ms. Welsh? Ms. Welsh, unmute yourself again, please. I'm not hearing you.
Yes, you were breaking up. Go ahead.
Right. I was telling you that based on what we got from the information yesterday, if your child is not vaccinated, they will not be face-to-face. They will have to do their schooling from home.
Okay. And what I need to know, right? What if the child does not want to take the vaccine? Because bear in mind, the nurse is supposed to be here listening also, which we all know in the nursing field that once a person doesn't want something, we don't force them. Am I correct?
You're correct. And we're not forcing anybody. We're just telling you that if the vaccine is not taken by the child, it will not be face-to-face. We're not preventing them from being educated. They will do their lessons online.
All right then. Thank you very much.
Okay. Tishan. Tishan.
Good afternoon, everyone.
Good afternoon.
Okay, sir, I understand because someone already asked a question about the vaccine.
Okay.
But the next question I'm asking, my son is now going into grade 8. I got information on his email pertaining to the documents and the medical and so forth, which I sent in the medical already.
Right.
But how am I going to know which grade my son is going in? Because I don't have get a grade 8 coordinator or nobody like that to post the info. because I'm just in only the grade 7 info I'm getting, and he's going into grade 8. So
All right,
it's like I'm lost.
It's not lost. You'll be going into grade 8. It really doesn't matter which grade 8 you'll be going into. You'll be going into a grade 8. It's just that we have not, he's not repeating. So if you say that you get the report and you get the documents and you never get a repeating letter, then he's not repeating. He'll be going into a grade 8, and we'll just have to sort it out in a manner where we have to deal with each student individually based on what has happened during the pandemic. So those students who have shined, they will be taught in a manner that they're at the next level. If your child was not shining, get 13% average, get 20% average, it means that the child would not have been shining. We have to prepare our teachers. Our teachers are prepared to make sure that they go to the next level, they pick up in order to go to the next level next year. So all of that we have to look into before we can really tell you that he's going to be in 8SPOTVAL.
Okay, but sir, actually I missed the first part because I'm currently at work, so I did not get the first part of the message pertaining to the vaccine or so forth.
All right, it was recorded, so when I'm finished, I'll be putting it in the teacher group and they will disseminate it to the different groups.
Okay, thank you very much.
You're welcome. Patricia Campbell-Jackson.
Yes, good afternoon. Are you hearing me?
Yes, I am.
All right, good afternoon again, everyone. All right, so I have 2 sons coming at the school, right?
Yes.
Jaquan and Jakeem Jackson.
Okay. Mm-hmm.
I did not get the first part of the message because actually I did not see the text when it was sent in the group. So I came on just minutes to 2. So I was here talking about the entire vaccine thing. So what I wanted to know, because just some clarification in regards to the vaccine, is it that the vaccine is going to be given at the school?
No, the vaccine, one of the letters that you have gotten today have the information of where the different vaccine will be taken.
Where was that letter sent?
It was sent to your child's email.
Oh, it was sent in the email?
I made sure, but it was also sent to the WhatsApp groups.
All right, it wasn't sent to the groups, so maybe in the email, because I haven't checked their emails as yet.
All right, which group are you in?
7V group and 7E.
7V.
And 7E.
And 7E. So it marked grade 7V?
Right, that's Miss Itchman class and Miss. Right, and 7E, that's Miss Grange and Mr. I don't remember that teacher name, but Miss Grange. So the form was not sent in the group. It's only the link for the meeting that was sent out.
All right, that could be the 7V. All right. All right, your name in the group is?
Patricia Campbell-Jackson.
And what's the name of your child?
All right, so it's Jaquan Jackson and Jakeem Jackson.
Jaquan. All right, give me a few on that and I'll send it in the WhatsApp group.
Okay, thanks. All right, next, I have a next question. All right, so in regards, because I heard the minister talk in regards to the vaccine, I know that kids won't return back to school if they're not vaccinated, right?
Uh-huh.
So is it a case that the ones that will not be vaccinated, they'll be staying home and do online, right?
Yes.
All right, so in regards to like book rental and stuff, is it that there will be a message sent out in the same 7th grade group? I think I heard a parent ask that same question earlier on.
So it's either in the 7th grade group or in your child's email.
Okay, because I was actually watching the dates and I'm saying I'm not hearing anything, and that school's supposed to open September 7th. That's what you send out in the email when you send out the reports.
Yeah, so we didn't get all the books that we're supposed to get for school closed, because what should have happened is that when you bring in your book, you would have got the grade 8 books, but that didn't happen
Right. I sent in my two boys book and we didn't get any book.
Right. So that is what happened.
All right, and the next thing, I went to purchase the literature book and I can't get it.
Oh, which literature book is that?
The Over or Away. Because I was in St. Elizabeth last week and I stopped at 2 bookstores there and they didn't have it, and I checked Montego Bay and I can't get that book. And I like when my kids have the literature books.
Where in Montego Bay you check?
I check Anderson and Songsters.
Boy. All right. I'm going to ask you, please. I just send the message to Jaquan. So you can check it. You can just send me that information that you're not getting the literature book. You should be seeing it now. No, well, they're not at home yet, but it's sent to Jaquan Jackson.
Okay.
Number 3328410.
No, is WhatsApp number?
Yes.
No, 3312545. That's Jaquan Jackson WhatsApp number.
331
2545.
24
331 2545.
All right, then. Let's see now. All right, then. All right, then. I think I found it. All right, so finish with part, Mr. Buckridge. Mr. Buckridge, you can unmute, please.
Good afternoon. I was just good afternoon. I'm Jillian Buckridge. I was just saying, like, I don't get any report. I'm from grade 8.
You're in grade 8?
Yes.
Did you check your email?
Yes, I am in my email, my school email, and I'm searching and I don't see anything. I'm just seeing long time something. I don't see anything. I don't see nothing like boot list. I don't see nothing. Medical forms. I'm in my email. I don't see nothing.
All right. Can you type in the message room there, in the chat room right here? So your email address, please.
Okay.
Barnes? Barnes? All right, Mrs. Smith.
Yes, good afternoon, everyone.
Good afternoon, Mrs. Smith.
All right, so for Gabrielle Smith, I've been having issue with her email from day one. I didn't receive the book list. I didn't receive the report because I couldn't log in on Renweb. However, I had to be speaking with Mrs. Stevenson in order to get the report in the parent group in order to get the book list and everything. So I'm not sure if the system doesn't have her email on it, but I don't get anything at all from the school via the email. The only thing she can do though is log on to online classes with the email, and that's it.
Yeah, but that's funny because if you log on, it's the same system and the thing will be sent there. All right. Gabrielle Smith, you said?
Gabrielle Smith.
All right, you don't move from there. Just keep your mic open. Don't make any sound or anything while I see if I can get to another parent. Somalia Knight.
Okay.
Yes. So whatever details you need about the child, you have to check the email address. That's where the book list and everything sent.
Yes.
Oh, because I was
Because
looking towards the,
we were
I was
trying.
looking towards the group.
No, you're going to see it in the group, because remember, certain things are confident. Confident. We were trying
Okay.
not to have the parents here in like gathering too much. So
Yeah.
we didn't go the way of handing out reports. And this is really the way to have the reports by email. And then we're going to have a conference. That's the future. We have a conference. So you get a time to look at the report, and then we'll have a day that you come and speak to the parent.
Okay. Okay. I will return to Jamaica next week, so I will see all of these things.
All right then.
Okay. Thank you.
But she's supposed to be able to go in the email and forward it to you.
That's for me, Mr. Thompson?
No. I was speaking to the parent before.
Okay.
All right. So right here, I'm looking at Gabriel Janil Smith. And I look back email history, and I don't see one thing emailed to you. Tell you the truth. So I am going to, but I even emailed the reports back this morning, so I don't understand. Oh, hold on there. Let me check demographics. So hold on for me, please, parents. Let me just double check here.
Okay.
There is not even one email here. All right, do something for me, please. I'm going to need an email because your child email is not here and your email is not here. There's no email here. Write down my number, please. If you don't, you have my number, you know my number?
No, I didn't have it.
All right, you have something to write it down?
Yes, go ahead.
445 28 69. So I'm going to need for you to send your email and your child's email for me, please, as soon as you can, while I speak to other parents here. Where am I?
Okay, I can do that now. Thank you.
Come on. All right, let me see now. Miss Smith is gone. Crisante Shirley.
Hi, sir.
Hello.
You hear me?
I hear you now.
Okay, I'm just asking a simple question because I already talked to you about the reports from this morning.
Yes.
I contacted a lawyer to find out. Remember, I also told I didn't like what the teacher posted up about must take the vaccine. And I asked you if she can change that. So while I was on here, I came off to contact a lawyer, right? Did you know that no one can force an underage child to take vaccine? So I stated to them that I forward everything that you guys forwarded to me. And did you know that my child can still go to school wearing a mask without taking the vaccine?
Okay,
Sir.
dear. We will have to pick up that with the Ministry of Education. So your lawyer would speak to the person at the Ministry of Education.
No, but I'm just telling you in here also because you said a reference because my phone dropped out at the meeting when you're even talking about the BCG vaccine that children got, even we the adults got. It is not the same, sir, because remember, BC vaccine, they tested it. Remember, right? CDC passed it. This vaccine is not passed nowhere in the world. It is not potent nowhere in the world for you to take. Right?
Okay.
And the Delta virus is only going after the persons that are vaccinated. It is mostly affecting the persons that are vaccinated. No, I'm saying you guys, the government, even some of the teachers, you're putting a stop to children because you know that a lot of children do not have devices to go online and go to school where they have to be.
Hold on there. Let me ask you a question. Did Spot Valley made that rule?
No, I never said Spot Valley made that rule.
Right,
sir.
but you say you teachers. No, you
I
have
said
to.
some of you teachers also, because some of
Yes,
you
teachers.
don't want
The
to take
teachers.
the vaccine because of what your work, because of needing your work to provide for your family, you have to take it. Because under the slide, they have made it mandatory for you to take it. You take it, your paycheck gets higher, you get a better pay. If you do not take it, they cut your pay and a whole lot of things. Why don't you
All right,
tell them that also?
And so I'm glad that you understand what is happening. You are feeling it out there at your workplace, when we just have to go by what we are under. We are under the Ministry
But
of
sir, if
Education.
all of you as teachers and principal band together and say we are not taking, as you said, you took it, you
there is
didn't have
more,
a side effect.
there are more parents than teachers. Why not see if we can get all the parents of all the
Sir,
schools?
that's what
Hey,
I'm just saying. Why don't you listen? I'm saying, why don't everyone band together and say no, like in Guyana, like
All
in
right,
Italy,
so
like in other
so I
countries
get-
that are saying no, like in what the other country name? It's a small
yeah, but,
island also.
yeah, but I don't think that this is a forum. I think
Hey,
maybe we need to
Bahamas.
get a wider
It's a
forum.
forum to talk about it because most parents don't want their child to take it, and it's not like they're going to tell you that, okay, I do not want my child to take it, but I still want my child to come to school because online learning is nonsense.
All right, so parents have been.
Don't learn on online, sir, and most of the parents who are truthful to themselves can let you know that are foolish.
Okay, so the parents have been voicing their opinions sincere, and I have not called down anybody. I accept they said that they're not going to do it, and I can't do anything about it.
That's true, but you guys are not giving the children the opportunity as much as you're the principal. You can state to the Ministry of Education and the government and state that some of the parents are saying that their children are not going to take it, yes, right? We are not going to close our doors to them. They can wear their masks. Remember the other day, you guys are stating that to come back to school, the children had to wear masks. Now you guys are singing a different song.
Who are you guys?
Everybody, principal, government.
Again, let's go again. We go by what the ministry said. So our school at Spot Valley here was one of the last school that was open. We got to go ahead to bring in the grade 11s, and so we did. All right. So we tried to open school, and we were reprimanded by the Ministry of Education. I was reprimanded. I was called by Dr. McLean. I was called by Dr. Troop. I was called by our one down here, Dr. Pinnock. So please, I am telling you this.
Sir, can I ask you a question? If you were called and reprimanded by all those doctors and people, why did you not call each parent and tell us and let each parent take a placard and take it to the street? I would have led that placard division to Ministry of
to do to try to bend the arm of the ministry. Right?
Sir, I'm not bending their arm, because my child has a right to free education, as they state. It is free. My child has asthma. My child has a lot of sickness, and no one but God will take her off of this earth before time.
But guess what? Again, I will tell you this, that was a case of going to prison, and I'm not going to prison for nobody. So at that time, I was breaking the law, so them said, and so I abide by what they're saying no, all right?
Oh, so they say you could go to prison for that. Well, the government not go to prison when they hold meetings. Where place them right now?
All right, mommy, hold on now. Let us
parties. They didn't go to prison when holding dream weekends. They didn't go to prison holding hard rock cafe.
Right, but guess what? This is not the forum. So can we just give the parent a chance to do what they're doing so that we can finish? We have been online here for almost 2 hours. All right.
Have a blessed day, other parents.
Okay. All right, Ms. Phillips.
Okay, I was just asking again if I didn't get a packet for my son. I didn't get a medical form. He was at summer school, but he doesn't go the last 2 days when he was supposed to go. So I didn't get a
That's all right.
medical
That's all right. That's all right.
form.
Was he online?
No, he was in summer school.
No, man, he wasn't online at all, so he wasn't getting
No,
any-
he wasn't online. No, he wasn't online because he's a slow learner, so he doesn't understand. So it was hard for him on the online class.
All right, so it means that you would have to come here and pick up that package because as said before, we had emailed everything to the government email that was given to your child. So you would have to come and pick up that package.
So when could I come for it? Wednesday?
Yeah, Wednesday is good.
Okay then.
All right.
Okay then. Thank you so much, sir.
You're welcome, my dear.
All right.
Barnes. Barnes, one more.
Good afternoon, everyone.
You're here, okay, because I had to take you off just a while ago because I wasn't hearing anything from you the first time. Yes, Barnes.
Yes, sorry about that. So,
That's
sir, I already understand about the vaccination and all of that. So, my child and I, we have made our decision.
Yes.
However, as it relates to the books, you just said to a student that the book list was sent out.
Yes.
I received the book list. I received the report.
Yes.
However, somebody promised that the book list would be narrowed down because remember, we can't buy all 20 books because we don't know the areas that our kids are going in.
This is grade what?
Going into grade 10.
All right. So right now we're still having issues with getting teachers. So we don't have automatic, we don't have plumbing, and it is cause of concern because it doesn't make sense the student have that subject that they pick for and they're going to be here without 2 classes. So we're kind of in a little problem here, and I trust you that the letter would have told you that they have 2 days of orientation, and those 2 days was what would have been used to sort out everything. So we have interviews for teachers next week. We still don't have any welder. We still don't have any plumber, but we have interviews for other teachers at this moment. We have interviews for English, and your child could be a part of the English teacher missing. We have interviews for physical education. Again, your child could have been in that bracket. We just don't want to give you these things, and when time comes, we have to make the change because we don't have the teachers, and then we get cussing that you make you buy the book and the child not using it. So we're trying to sort out things as best as possible, and I guarantee you that although it will be late, we will find ways of dealing with the issues, make sure that they have the rental book, and then we try to see if we can get the books after we get that list. So I'm going to be dealing with that in his, especially interviews, and then we'll get back to you on that. So the email, your child email is the most, what you call it now, is where we can really communicate for sure. All right?
Okay, sir.
Okay.
Okay, sir, thanks.
You're welcome, Ms. Barnes. Knight.
Yes, I'm here.
You had your hand up, or it's from long time?
Yes, I have my hands up. Because as I said that I'm in Canada.
Yes.
And when you go to the street, it's just 1 and 2 person have on mask,
Oh,
right?
Yeah. Mm-hmm.
Yes, 1 and 2. I can tell you that. I can even take pictures and post it in the group. How long are we gonna be in lockdown for in Jamaica? Because I'm coming home next week and I have to be sending days to get a drive to come for me, that to prove that I'm coming, and one other things. But anyway, why are we attacking teachers? We know that the vaccine come out. Why don't we write that placard and go to the street for the government to see? Why are we attacking teachers? Is teachers the government?
Hey,
I don't think so. I'm not sure why we're attacking the teachers. The teachers go by what the government says.
Lady, did you see me attacking any teachers? I am talking about my right and the right of my child. Did you see me attack any teachers? Not because you're
Yes, Miss Knight. Miss Knight. I really apologize for that, parents. I really apologize for that. Miss White.
Yes, good afternoon. The last time I checked, I guess everyone have their right to speak and say whatever they want to, but I'm not going to get into that ball that is rolling right now.
Yes, yes.
My main question is, because I came on late, is that I want to find out if it's in a case where Dante has to do the medical and bring it by the school in order to go forward, also to pay that 2,500 that is requested.
All right, so most important than anything else, every year a child is supposed to do a medical. We don't want to be held liable when we give a child something to take when we hear that he's not supposed and we never get a medical. So we request that the child gets the medical in. The medical will not guarantee this year that your child will be in school face-to-face. What will guarantee him being face-to-face until they make some other changes.
Right.
Until they feel like to make
well,
some
as you know, you're going to tell me the vaccine, but as for me, it's a no for him. So I know that it will be at home. So for the vaccine, it's a no.
Yes, so we need a medical, and the 2005 part of it is, in which grade is he going in?
8.
Going into grade 8, right? So part of it is insurance, which I saw over this period here, where parents who refuse to pay the insurance, things happen to their children, and they couldn't find money to pay for it. And if they had paid the insurance, whether they are foreign or wherever, the insurance will hold up. So part of it is for that. The other part is for admin fees, and that is what you basically.
All right. So whenever I get the medical done, maybe sometime, maybe like Wednesday, Thursday, it's okay to come by the school with the medical on any day, and also with the 2,500 to get everything else done.
Yes, ma'am. Yes.
All right. Okay. Thank you.
Thank you so very much.
You're welcome.
Ms. Vernon, Anna K. Vernon.
A pleasant afternoon to everyone. Sir Principal, good afternoon to you as well. I just want to say that Jordan McBean, he did not receive anything to his email address. While you were speaking, I was also checking. So I just checked and I'm not seeing a report. I am not seeing a book list. I am not seeing anything besides previous communication that would have been sent for, like when he does an exam and the teacher may send back something like that, but nothing as per a report. McBean.
McBean, first name?
Yes. Jordan with a Jordon.
Gary.
Yeah, yes, that's the middle name.
Okay. All right, Bob.
If you would like the email address, if you don't have it there, I have it as well, can provide to you.
I have a Jordan DM McBean 605 at MOE.
Correct.
Hold on, let me just check the email history. All right, so what I'm seeing before me here is that everything was sent: report card, attention to parents, package pickup, August 20, July 30th, April 13 is when that's sent out. So the parent before, I never see anything at all because there was nothing there. There was no email there, so that was sent, but I have it here before me that it was sent. So what I can do is to resend it.
Okay, and you're saying that initially it was sent to his to his email, the government email?
Yeah, man. July 30th, you got the package. Confident report, July 30th. Package was sent again, July 30th. So there are 2 July 30th packages that was sent, and the report also on the 30th of July.
I'm still looking while you're speaking, but I'm not seeing it. I've checked spam, I've checked all the other parts. I'm still not seeing it. The last email he got is July 2, and that was from Miss Black. And that was like Google form, some news
Alright.
announcement, but there was
Right.
nothing else.
So let me confirm the email address then. So the email address, sorry parents, I just need to make sure that this is done properly.
And thanks, because I keep bumping off each time, so I was wondering when I would get to ask.
All right, so it is JORDON.
Yes.
Dot.
Yes.
BMCBEAN.
Yes.
605.
Mm-hmm.
At moeschools.edu.jm.
Correct.
I don't know what is happening. Give me your email address if you don't mind.
All right, sure. It's FAY COYA 2019 at gmail.com. And the first letter is F as in Frank. Okay.
No problem.
Yeah. Yes.
All right, so that is Jordan. All right, I'll try to sort it out before I leave.
Okay, thank you, sir. Much appreciated.
Welcome.
I've already gone ahead to submit his medical report at the school, so that is already there. I got a package, I think it's like insurance to sign up to complete something of that. I haven't done it yet, but I got that, but nothing else.
All right, will do.
Okay, thank you so much.
Thank
Have
you.
a good day.
Same
You're
to you.
welcome.
So that was Anna K. Vernon. Raquel Thomas. Raquel Thomas.
I have to unmute. Oh, here it is. Okay. Hi.
Hi there.
Mr. Thompson.
How are you?
Can you hear me?
Yeah, man, clearly.
Awesome. All right. I came in while there was a question asked about the books, the rental books. So I have a question about that. I also have a question in regards to the insurance because we have decided not to do the vaccine yet. My husband is watching the news very carefully in regards to everything that's happening around the world and how it affects us as individuals and as a country. So we're not taking the vaccine. So I understand that Chumani and Johnny will be schooled at home. Okay. So the question is in regards to the insurance, do we still have to pay the insurance?
Yes, as I explained just a while ago, the insurance is a safety tool. Even during the COVID period here, there are some parents who would have unfortunate cases where hand broken. Those who paid the insurance, they got funds back from the insurance. Those who didn't, we couldn't help them.
All right, but because the boys are going to be homeschooled,
Yes.
be at home.
Yeah, but anything can happen. Are you sure that you are okay with that?
So even if something happens at home,
yes,
that
ma'am.
insurance covers them.
Even on the weekend.
Okay.
Once it's
all right.
within the 190 days of school.
Okay. All right. There is I need to answer about the book list, but I have one more question after you answer the book list. You said I didn't get the response about the book rentals.
Book rentals, we didn't get back the books that we needed to get back when we asked for them after school closed. So what would have happened, the process would have been grade 9 bringing their books, expecting to grade 10. When grade 8 comes, they will bring in the grade 8 books and they would have gotten grade 9 the same time. But that didn't happen because we weren't getting the books in large numbers. So books will be given out, rental books will be given out after about a week or two when we see the students and can collect the books face to face before we can issue back books out.
All right. I had a little of an idea in regards to that. For persons from the 8th grade that returned their books and the persons from the 9th grade that returned their books, you could have given those 9th grade books to the 8th graders that's going into 9th grade.
And that's what I'm saying. That is how we usually do it. Grade 9 will
Oh.
come first, leave their books. When grade 8 come the next day, they bring their books, the grade 9 the same time. But we were not getting the books in numbers, so that didn't happen this year.
All right. Okay. So even though my boys will be home for the school, they will still get their rental books.
Yes.
Okay. Now, both boys are on path. I know that I have to come in with the receipt to show that they're on path.
Right.
That I still need to pay the insurance, or does that path covers all of that?
Path covers that.
Okay. All right. That's my questions, Mr. Thompson.
All right, my dear.
Thank you. Have a great day and be safe.
Same to you, Ms. Thomas. So parents,
Thank
once
you.
your child is on path, there is, I think, a $2,000 that is separate apart from what is on the paper. Your insurance is paid, and I can't remember what the other item is, but I'm quite sure your insurance is paid. So when we're ready to send up the list, we always check the path list first, put on them first, and then we look on those parents that have paid the insurance. So you're okay, Ms. Thomas. Not hearing you, Ms. Thomas. Hold on. Go ahead and unmute. Ms. Thomas, you can go ahead and unmute. All right, look like Ms. Thomas frozen. I've sent you the privilege to unmute, Ms. Thomas. All right, yeah, she is not hearing me. All right, so I'm going to go to Kay. Kay, you can unmute yourself.
Okay. Oh, Lord, I totally forgot the question.
Hi, good afternoon. I totally forgot what I was gonna say because I was waiting so long.
I am so sorry.
One of them was my daughter is going into grade 10.
Right.
So the code to go online, how would I get that? When would I?
So she was not online any at all for the last school year? Okay. Hello. Okay, can I hear you? All right, while we wait on Kay, can Shalom go ahead? Shalom. I sent you a guide to unmute. All right, parents, it has been a very wonderful day, and I hope that you have gotten enough information to make changes, make positive changes. It's all about your child, and you just have to respect your decision. Hold on, Shalom is here. Shalom. Shalom.
Hello.
Yes.
Good afternoon.
Good afternoon.
I would like to know, how does you get to pay the insurance fee? Because I already did the medical, and I sending back the paper by the Montego Bay library.
Right.
So how do I get to pay for the medical fee?
You pay for the insurance, not the medical fee. You pay for the insurance by coming by the school. I think that can, well, you need to do it before the school year starts, which is September 1. It's not
Oh,
like,
so I can do it on any specific day once we are free to go out on the road.
yes.
Okay, and it's 2,500.
No, the insurance is $500. The $200 is for administration fee, I think. I don't have the
Okay.
figures before me.
Okay. My son is in grade 7, and I don't sure if he's gonna repeat because his score wasn't excellent any at all. Could you give me advice, any tip on that if he's gonna repeat grade 7?
You got a report?
Yes.
Right. So you would have gotten something to say that he would have been repeating. So if you just got a report, you're good. If you didn't get another letter saying that he's repeating, then he's going to the next level.
So when we're because this is his phone, I didn't get it in my WhatsApp, so I would have to check his phone.
You'd have to check his email address.
Yes.
Yes. All right, Shalom. Buckridge.
Yes, sir. I was saying that I send my school email in the chat so I can see my reports. So I can see my report, sir.
All right, will do. Malika.
Yes, sir. Good day.
Good day.
Sir, good day. Sir, for grade 10 students, right? Although you have the book list, how do we know which subjects we are going to do? Like the subjects we're going to place, we can't just buy anything like that.
All right.
So
So we're having some issues. If you're on earlier, that we heard that we have some issues with getting teachers. Until that is done, we can't really confirm what subject you're going to be doing. So we will be waiting until we have our day of orientation, which is 2 different days, because we have to spend time on that. We'll have a whole day orientation and making sure that everybody is sorted as it relates to the subject that you're doing. The buying of the books just have to be done after that, because at this moment, because of the pandemic, because you're online, because of the uncertainty, we can't give you a definite as yet.
okay, sir.
All right. So let me quickly all right, Mrs. Smith. All right, I do not see much in the chat, so I'm going to say thank you, parents, for being here. I see one question here. So what if the kids have underlying sickness like sickle cell or asthma? You're the best person to take the vaccine. You can speak to your medical doctor and they will tell you exactly what is to be done. But as far as I'm concerned, based on what I've read, the persons who have underlying issues are the persons to take that should be taking the vaccine. All right. All right, so that's it. I won't be getting a CIFA part until I pick up the September 20 and still have medical form. We can use a slip that you used last month, Ms. Thomas. So the kids who are in non-communicable disease, can it? Yes, you can take the vaccine. The vaccine is for everybody. All right, since there is no other, I'm going to say thanks to the parents again for being here, and we're really looking forward for a good but challenging year, and we're asking for your cooperation as we go forward. Please have a wonderful day. Kenny Dwyer, yes? The one for June is okay, Ms. Thomas. All right. Good afternoon. I don't talk to this. Anyways, yeah. No. One of the entertainment to that. Yes. You know, I'm stress. Stress me. Ah, yes. All right, there's a over the hill, me I go. Over the hill, you need to learn over the hill.
No, actually, no. Why did I?
I don't know.
I don't know why did it come that way. But leader come down. It wasn't too bad that day. But I drive to the hill, Baba, because we can't deal with the traffic on it. So
Yeah, my wicked man.
yeah, it's dead, man. And you know the late I get the worst it's going to be, right?
Over the hill, me I go. It never worse going over the hill.
All right, so you might pass your example.
All right, cool.
All right, here you go.
All right.
Hello.
Hello, good afternoon.
Good afternoon, Mr. Company.
You are the parent in Canada?
No, man. I am Mrs. Smith in Roseville.
Or Roseville?
Mm-hmm.
So how you have 806 number anyways? I mean, I think that this was a
No, man. We never want them take my number because this is the one of the things when I'm overseas, so I'm trying to keep it active.
and the parent from Canada, I really want to find. No, find
Oh,
her.
that was Thomas?
No, no, Miss Thomas. It was another one. It was the one that was defending me, but me that try to say she not to defend me because they say the parent that's how she is all the time.
Right.
And you notice me just sit down and she just talk. And she just love to talk. So
That was crazy, then.
yeah.
No respect whatsoever.
That is her. That is her. That is her. All right, though. I won't waste the time though, because I'm looking for this parent. So later.
All right, then, no problem.
Mhm.